Going to enjoy this segment. I'm here with Dr. Harold Katz, an old friend of mine. In fact, we've worked together many times.
Right. That's right.
And Harold, you are the founder of TheraBreath, which is an amazing tool to get rid of bad breath. And there are lots of things that can cause bad breath.
Oh, many things cause bad breath. Everyone has a mouth. And in your mouth, your mouth are 20 billion bacteria at one time or another. That's 3 times as many people that are on the face of the earth. A lot of bugs.
That's a lot.
Yeah, most of the bugs are good. They actually help prevent bad breath, help prevent tooth decay, gum disease. Some of the bacteria are predators, and they create a lot of problems. So what I want to talk about today is how to keep your mouth really clean, make sure your breath is fresh, your gums are healthy, your teeth are white.
Because oral health can really, as you say, lead to some serious health issues.
Well, your mouth is the doorway to the rest of your body. Many studies show if you have a lot of bacteria in your mouth, they can travel through the body, affect your heart valves, the prostoplacenta, affect the embryo, brainstem, a lot of problems. So keep that mouth really clean.
Okay.
Everyone has toothbrushes, I hope.
Yeah, me too.
The big mistake people make is they use either a hard bristle brush or a medium bristle. Never use hard or medium. They're much too hard. They will destroy tooth enamel, destroy gum tissue. They can even make your gums bleed. And bleeding gums is the main problem here. Once your gums start to bleed, you literally have an open wound site, which allows those bacteria to travel through the body. Use a soft nylon bristle brush. The power toothbrushes are great. Most of the heads are soft. The ones with rotary heads are much better than the ones that go back and forth.
So they spin around, and they have like two. One goes one way, one goes the other.
Exactly, much better. And the new type of toothbrush is called an ionic toothbrush. It releases positive and negative charges. It gets the plaque basically to just fall off your teeth.
And that's this one right here?
Yeah, an ionic toothbrush, brand new. We
actually have such a thing.
Yeah, we have them on our website, TheraBreath.com.
Okay.
Another issue is flossing. People hate to floss.
I floss mine twice a year when I go to the dentist.
and your dentist knows. Your dentist does know.
And I tell them right away, don't bother telling me. I don't want to hear the lecture because I'm not doing it.
Yeah, you're going to get the lecture. I'll give it to you later.
All right.
The way floss works, it's the only way to get rid of the gunk in between your teeth. Gunk is a technical term. So it doesn't matter what you use, a floss pick, whether they have mint on it, the traditional floss, even little interdental brushes. You got to get rid of that stuff. So sit down in front of your favorite TV show, sit down in front of this show tomorrow, take your floss and floss your teeth. Your mouth will be happy you did.
Okay.
Cleaning your tongue is very important. Your tongue tells you a lot about your breath. If your tongue is yellow, has a white coating, that's a sign you're overproducing sulfur compounds.
Okay.
Got to keep the tongue clean. That's where a lot of bacteria come from.
Good advice.
A tongue brush does not work as well as a scraper. The brush basically just moves it all around, doesn't lift it. A scraper is a much better way to do it. It actually lifts it from in between there. Now, you can't get rid of the bacteria permanently, but it does help.
Now, you brought, I'm going to get along with this before we run out of too much time.
Okay.
Your breathalyzer.
It's called a halometer.
Halometer,
yeah, it measures the amount of sulfur compounds in your breath. That's how you know if your breath is fresh or not.
Okay.
Anything below 100 is good. Above 100, your breath sucks.
Oh, okay, very good.
Okay, so you brought along an onion here.
We have onions and garlic here.
Yeah, take a little bite and we'll see what an onion does.
Okay.
Let's say you go to a wedding and there's some onions in a salad.
Okay.
And
Fortunately, I like onions.
Okay. So let's take a look and see what you got there. Just stick your tongue out and hold your breath. Okay. Open your mouth a little bit. Oh, my God. 350, 640. You hit 2,000.
That's bad?
Yeah, that's bad. Now, here's one of the lozenges we have available called TheraBreath dry mouth lozenges.
How long has TheraBreath been around? You've been
around for 20 years. We actually have a line of mouthwash and toothpaste. Does not contain any alcohol. Contains an oxygen compound that literally gets rid of the bad breath.
And I'm sucking on one of these, right?
Yeah, one of those. And those are available at Walmart and Target. And Smith's has them.
Okay.
Yeah, what they do, they actually release oxygen compounds as well as salivation material to keep your mouth moist and to get rid of the bad breath.
Okay.
So let's take a look what your breath is.
And it's minty fresh, too.
Minty fresh. Okay.
Okay, how'd that do?
Okay, just stick your tongue out. Let's see what you've got there. You were at almost 2,000. You're down to about 160 now.
Just like that?
Just like that.
That's amazing, Doc.
You are kissable.
Oh, good.
But not with me.
Keep your distance. We're running out of time, but where can people get more information?
Okay, TheraBreath.com, THERA breath.com, or they can call me directly, 800-557-6960, 800-557-6960, and get some free TheraBreath products.
Terrific. Dr. Harold Katz, TheraBreath.com.
You smell great.
Thank you so much. It tastes great, too.